My name's Ray Basili. I live in Omaha, Nebraska, grew up in New York City, and have been out here in this area for about 30 years. I worked for a large company that offered employee-sponsored health plans. It was a really good plan. Not too many companies offer a plan like this. It had very low deductibles, but of course, over time, the deductibles did increase. They were not always as low as they started out to be, but the company obviously paid a portion, I paid a portion, so it was a good plan. Well, what happened is I left this company and went to work for another company, and they had a company-sponsored health plan. Was not quite as good as my first one. It was costing me $700 a month for my wife and myself, and it had a much higher deductible. Well, I wanted to start looking around what my options were this was when I was past 66. I would have been available for Medicare then, but I didn't really start the process till about 67. And I always saw ads on the television for calling 800 numbers. So I called some of them, and in many cases disappointed because the people that answered the phone were not very knowledgeable, and in half of the cases I never got the information they promised to send out. When I did make some calls, again, there was not a lot of knowledge about anything, and so I kind of never really followed or pursued it further. A good friend of mine, we were talking about this, and he said to me that he had worked with a gentleman, Chris Grimmond, and was very happy with him, and he gave me his name and number. I called Chris, and we met at his office one day, and Chris went through the whole scenario, explaining in great detail the Medicare options, what companies are available to work with, and really kind of simplified the whole process for me.
There?
Absolutely. He works with numerous different companies, and said that they were all available, and kind of went through everything very well. I decided to go with United Healthcare only because I had that as my health carrier with my corporate plan, and the company I worked well with them, and their customer service was very good. So I went with United Healthcare, and I like the plan quite a bit. The deductibles are way better than my corporate plan. They offer quite a few other benefits that I've taken advantage of, such as vision, dental, gym memberships, and drug plan. I would not hesitate at all to give them his name. And I told Chris, he was such a hands-on guy after the fact, followed up to make sure everything was in place, everything was working, that I was able to get everything through the prescription plan that was part of the Medicare plan, that I would be a referral for him for anybody he needed.